Well, we are diving into a new approach to healthcare for older adults, and we've got Andres from Basis Health here to share how their practice is reimagining care for the aging population and what sets them apart. Welcome, thanks for being here.
Thanks so much. Glad to be here.
Absolutely.
Yeah.
Well, we kind of just set you, oops, I've knocked all my stuff down. We set you up, but what can you tell us about Basis Health?
So Basis Health, kind of what you said it, we're reimagining the way healthcare is delivered. We want to kind of flip the model on its head, where patients are so used to going into a doctor's office, waiting a long time. If they get sick enough, they have to go to a hospital system, right? Our approach is let's take the doctor, let's take the entire healthcare clinic and bring it into the patient's home. Let's take all the barriers outside of that would prevent a patient from getting the healthcare they need and bring it into the home.
Yeah. You know, I think we've had your father on here
Absolutely.
before chatting about
Yep.
this. You all are so passionate about this, and you're
Absolutely.
right. It's just flipping the model around, bringing the healthcare to the people where they are, removing those obstacles or barriers. Why do you think this is such an important service or you know, a new approach to provide to our community?
So Northwest Arkansas has thousands and thousands of patients that don't get the healthcare they need simply because they can't get to the facilities or they can't get to the clinics. So what we're saying is if we can give a suite of products, everything from urgent care, primary care, IV hydration, wound care, all these things, and package it in a way that we can deliver it into the patient's home or residence, it completely transforms that patient's life. It gives them health care. It ends the need for them to constantly be in a state of sickness, and they can stay in their home where they're the most comfortable for a longer period of time.
Yeah, makes sense. What sort of feedback have you received or any success stories that you might be able to share with us?
Probably too many, but right now the feedback has been that this is a lifesaver for so many caretakers of their aging parents or grandparents. But for the patients themselves, they get to stay at home. They get to be comfortable. They get to have a doctor come to them, take care of them where they're at. We have saved hundreds of lives, altered them, made them so much better simply because they're able to get health care where they need it and when they need it most.
What does it look like? Can you walk us through the process? People reach out to you and kind of then what happens?
Yeah, that first step.
Absolutely. So they go to our website, they give us a call, we'll get some basic information. One of the great parts about our process is that we only charge their insurance for this. We're not out of pocket. We don't pay a fee on top of everything that we do. So their insurance, most insurance will cover everything that we handle. So they call in, we schedule their first appointment, we have a provider go to their home, do that initial intake, just like a doctor's office normally would, but it's all done right there in their home, in the comfort of their couch, where they can sit there, get all the treatment they need, and then their insurance covers the cost of the visit as well. So it becomes such an easy process. Those barriers to entry for healthcare are completely removed when we offer the service we do.
That's amazing. It really is.
It is
and
great.
you were talking about all of those patients that you've been able to see, and you mentioned something, or you said removing obstacles or removing barriers, right? Because I do think sometimes it's a bit daunting.
And it wears them out.
Absolutely.
And by the time they get home from the doctor, they need to rest from going to the doctor, you know?
I don't like going to the doctor sometimes. It takes too long, and I can move, I'm mobile. If you have an 85-year-old patient with multiple chronic illnesses, it becomes very, very difficult. Why do that when we can just deliver that healthcare right to their home?
That's incredible. If viewers are interested and they want to learn more, if they want to keep up with what you guys have going on at Basis Health, where can they go?
I would go to basishealth.org as our website, or to any of our social media sites, which is all at just Basis Health. Go there, they can have all information and sign up and get some more information. Just see what the process is, see how easy it is to come on and get healthcare delivered to their home.
Yeah, that's great. Andres, thanks for joining us today.
Yes, thank you so much.
Really appreciate you and everything that you're doing for the community to remove those obstacles and barriers. Really exciting to see.
Yeah.
Absolutely.